If there's going to be one word in the English dictionary that all doctors hate, it's going to be the word unexplained. If you look at the bigger picture, almost 50 to 60% of most medical conditions are still unexplained, but none of the other conditions get the word unexplained in their diagnosis, like unexplained infertility. And there is a good reason for that as well, because imagine trying to explain to the patients that everything is okay, that is, the husband and the wife, all their reports are absolutely normal, but they still have a very less likelihood of conceiving when compared to their friends. So if the average person has a chance of conceiving about 20% in every cycle, a person who's suffering from unexplained infertility has only a chance of conceiving about 2% every cycle. Before we start talking about unexplained infertility, let's get the definition of infertility out of the way. Infertility is defined as a couple who have been trying to conceive without protection for over a year and they have not conceived, and this definition is for someone who is below the age of 35. Now, in unexplained infertility, the woman has a normal uterus, her fallopian tubes are absolutely normal, her ovulation is on time, her hormone levels are in check, and she has a good number of eggs, also known as the ovarian reserve, in both her ovaries, and her husband's semen analysis is absolutely normal. There is either a problem in the transport of the egg from the ovaries into the uterus, or there's a problem with the transport of the sperm through the vagina, through the cervix, and into the uterus. So what that means is that the egg and the sperm are really not meeting, and that's the reason why fertilization is not happening. And in some rare cases, there might be an issue in the quality of the egg or the quality of the sperm. If you want me to make a separate video on the quality of the gametes, that is the egg and sperm, do let me know in the comments down below, so I'll make a separate video on that. Like I've already mentioned to you, if a patient is suffering from unexplained infertility, then the chances of them conceiving naturally are very, very low, unless they seek treatment, and if they do, definitely their chances are much more better. Of course, no patient wants to go for IVF or ICSI directly, although the chances of them to conceive with IVF or ICSI in the first cycle is very high. We go through a process which has helped a lot of couples conceive without the need of going in for IVF. The very first method is absolutely simple. We ask the patient to come during her time of ovulation, which is usually somewhere between the 12th to the 16th day. During this time, we perform a folliculometry, which is basically a transvaginal ultrasound scan to know the exact day when the egg is released, and we ask the couple to have sex on that particular day to improve our chances of conceiving. Our next step is to give patients ovulation induction medication, which will help to release at least one egg every cycle. If ovulation induction fails, then we start the patient on super ovulation, where we give the woman injectables, so there are more than one egg which is released every cycle. So usually if she's a young woman, she might have around 2 to 3 follicles which are released, and if it's a little bit older woman, then she has around 1 to 2 follicles which are released. Only challenge with super ovulation is that you always have a chance of getting twins, and in our scenario, most women who are suffering from unexplained infertility don't have a problem with having twins at all. If super ovulation fails, our next step is to go and perform a diagnostic histo-laparoscopy, which is also a gold standard for women who are suffering from unexplained infertility. A diagnostic histo-laparoscopy is fantastic because it is not only diagnostic but also therapeutic. Several factors like the tube being too long, too short, or something inside the uterus or in the cervix can be diagnosed during the time of this procedure. And if you want me to make a complete video on just diagnostic histo-laparoscopy, do let me know in the comments down below. Once we finish a diagnostic histo-laparoscopy, the next step for the patient is to plan for a super ovulation along with an IUI. So we give the woman the same medications like we did before, but at this point of time we also go ahead and inject the sperm directly into the uterus, and I have made a previous video on IUI which you can go and click on one of the icons up there, so you can have an idea about what IUI is all about. To really shorten it out, intrauterine insemination is a process of freshening up the sperm, separating the good sperm from the bad, and directly injecting the good sperm into the uterine cavity. And please remember, by doing one IUI cycle, you are really not going to help yourself or the doctor. So you have to at least try around 3 to 6 cycles of IUI to exactly understand if an IUI is a success or not. Because the results of IUI are always cumulative, which means the more number of times you try, the higher are your chances of conceiving. There are no studies to show that over 10 cycles of IUI is really beneficial for the patients. So that is the time when we plan to do an IVF or ICSI for the patient. The only reason why we don't recommend an IVF or ICSI for the patient in the very first cycle itself is because if it's a failed cycle, most of these couples get demotivated and they stop trying completely, and that is a problem for us because we know that the more number of times the patient tries, the higher are their chances of conceiving. And that's the reason why choosing your clinic is absolutely essential. So if you have not checked out my previous video on how to choose your fertility clinic, click on the link that pops out there. So going in a stepwise way will definitely help the patient gain confidence, and at the same time you get to have a rapport with the doctor as well. I always urge the couples to not go in head first into IVF, to take it slow. Try to understand that the fertility treatment is like a journey where your gynecologist or your reproductive medicine specialist is the captain of the ship and you are his trusty crew members. So I've had a couple of patients who have tried the first 3 cycles of IUI, and then I tell them, try for 2 more cycles or try for 3 more cycles, and most of them I have found that within 6 cycles they go ahead and conceive. The idea is very simple. You have to keep trying. So I hope I was able to deliver some kind of value to you from this video. If I did, go ahead, leave a like on this video, share this with whoever has to see this right now, and if you have not subscribed, please go ahead and subscribe to my YouTube channel. I also post regularly on Instagram, so follow me out there. So until the next one guys, see you and have a lovely day.